The US military is sending more than 1,000 of its doctors, nurses, and other medical staff to New York City to help overburdened hospitals. Also, retired doctors, medical students nationwide volunteer in the battle against COVID-19 in New York City in response to the Governor Andrew Cuomo and Mayor de Blasio's calling for a national mobilization of medical personnel to fight the pandemic. In just a single day, 1,000 retired and private practice doctors and nurses answered City Hall's cry for help, volunteering to join the Big Apple's medical reserve and help treat their fellow New Yorkers stricken with coronavirus. Meanwhile, JetBlue and United Airlines have agreed to fly medical volunteers to New York City and back again, free of charge.
Instead of taking a break before his graduation, medical student Randy Casals is looking to get straight to work. The soon-to-be urologist and other med students have heeded his university's call for help and will be assisting doctors on the front lines of the coronavirus pandemic.
We'll go through patient charts and help write notes and call and help make appointments and just help ease the burden off of the doctors on the front lines. Helping people during scary times and helping them get better is why I chose to be a doctor.
Not only has New York's governor signed an executive order to let medical students graduate early, he's enlisting the help of retirees as well.
God bless America. People have volunteered from out of state to come into New York State. I thank them. I thank their patriotism. I thank their dedication and passion to their mission of public health.
But as COVID cases continue to rise, the city estimates 45,000 more doctors and nurses will be needed in coming weeks.
We really have to safeguard our health workers. This is going to be a marathon, not a sprint, and we have to protect them as best we can, provide them with breaks where they can really get away.
The streets of New York have been unusually quiet these days as all but essential workers have been asked to stay home. But every evening at 7, all across the city, New Yorkers, listen, have been coming to their doors and windows and cheering for doctors, nurses, and all first responders. Everyone knows while streets here are relatively empty, emergency rooms are full.
They're working so hard. I've never seen the ER, because I'm familiar with this hospital, as crowded as it was.
Dr. Sunny Moon, a licensed palliative care specialist, had left medicine, but is now volunteering at the hospital where she used to work, helping sick quarantine patients communicate with loved ones.
A lot of these patients are dying alone because they're on isolation. So for me, that was one of the other reasons why I wanted to help, because I felt like I could make a difference in such a horrible situation.
That dedication and community spirit finally giving New Yorkers something to cheer about. Kristen Salumi, Al Jazeera, New York.